Hi, thanks for joining this workshop for the Complex Fractures Priority Setting Partnership, or PSP. I'm Chris Bretherton. I'm a trauma registrar and I'm the PSP coordinator. And in this video, I'm going to tell you the background of the project and about what we've done so far. There's a separate video from Jonathan Gower, who's our GLA advisor, who's going to tell you about what to expect during the workshop on June the 8th and what you need to do to prepare in advance. And so AOUK and the Orthopedic Trauma Society are organizations that promote research and care for patients with fractures. Now, previously, research has mostly focused on the more common or simple types of fractures, such as around the hip or the wrist. And those are ones that usually just require one form of treatment, and often, relatively speaking, their recovery is more routine and more predictable. Complex fractures, on the other hand, are ones that often require multiple treatments or procedures over a prolonged period of time and require the coordination of multiple different healthcare professionals and teams. Examples of those include open fractures, where the bones are coming through the skin, multiple fractures at the same time, fractures around the pelvis and acetabulum or hip socket, and fractures to the joint that are broken into multiple pieces. Now, these fractures are less common, and so it's harder to design research study to tell us how we should best treat them. However, recently, with the advent of new global networks, the Orthopedic Trauma Society and AOUK said that now was the time to develop research priorities, because although these fractures are less common, most of you will know that they can be life-changing, and the treatment of them is often extremely challenging, and they have additional challenges for recovery. So why the James Lind Alliance? That's because they're an independent organization and they're committed to the principles of transparency and patient voice. So that means that funds from charities and the NHS are not simply going to answer questions posed by one or two surgeons or professors, but that the research priorities are reflectors of the whole scope of patients affected by complex fractures and those that care for them. The first thing that we did is that we set up a steering group, which included patients with experience of complex fractures and healthcare professionals such as trauma orthopedic surgery, plastic surgery, physiotherapy, psychology, and doctors with expertise in treating older persons. And this is a picture of our first and only face-to-face steering group meeting, well, for obvious reasons at this time. First thing we did is we set up the scope, and part of what we did is we looked at what previous research and priority setting partnerships did and made sure there wasn't too much overlap. And then we also looked at NICE guidance, and that's the National Institute for Clinical and Health Excellence, and they have a definition of what a complex fracture is. And again, it falls into these categories of open fractures, multiple fractures, fractures of the pelvis or hip socket, and fractures around joints that are in multiple pieces. But again, it could also be other forms, such as ones that have got nerve injuries or vessel injuries, really anything where that sort of whole treatment and recovery process has additional challenges. So we were looking at care within the first 12 months from injury. We were looking at surgical and non-surgical care, rehabilitation, both physical and mental, occupational therapy and return to work, and service design and delivery. We excluded some components, fractures in children, because they heal and they're often treated in a different way. Care in the emergency department and pre-hospital care, because that's going to be the focus of another priority setting partnership that I might talk to you more about on June the 8th. And also isolated hand injuries, because they have been the subject of a previous priority setting partnership. From there, we launched our initial survey at the Orthopedic Trauma Society conference back in January 2020, and we asked people to tell us their research priorities. We gave them free text boxes, but we prompted them to tell us about the in-hospital treatment, which included bones, treatment of wounds, as well as medicines, about rehabilitation, both physical and mental, return to function, such as return to driving, work, or hobbies, and then anything else, such as any personal stories that they wanted to share about their experience. We had 535 responses or suggestions that came from 158 individuals, 33 patients, and 125 healthcare professionals. And what we did is we grouped those 535 responses into similar themes to create 58 summary questions. We then searched the literature to make sure that they hadn't already been answered, because we don't want to spend time and money funding a study if it's already got an answer. It turned out, however, none of the sort of summary questions had been answered. So what we then did is we launched the interim survey. We used the same sort of social media networks, professional and patient societies, and the same going out to hospital wards and clinics as we had for the initial survey. But this time we asked patients and professionals to tick the top 10 of those 58 questions that you may have done. Overall, we got 136 responses, with 56 from patients, 80 from healthcare professionals. But as you see, because there were more healthcare professionals, we wanted to make sure there was a good balance between professionals and patients. And so what we did is we got the top 10 from patients and carers and the top 10 from healthcare professionals, and we then merged them to get a balanced final 18 questions that we will be discussing at the final workshop on June the 8th. And then this is just a map of all the respondents we had either in one or both surveys. And this is something we were looking at throughout the process to make sure that the opinions we were getting were, an appropriate balance and spread from all across the UK. So for the final workshop, as mentioned, there's a video from Jonathan you may have already watched about what it will involve, but broadly speaking, we're going to come together to produce a list, a top 10 list of research priorities that we will give to funders, and that will then inform future research. And ultimately, that's going to mean that in the future, we're going to have the best chance of answering questions that patients and their carers want to be answered, so that they can have the best care and the best outcomes in the long term and going on for the future. So I'm really excited to see and meet you all there on June the 8th. And for now, I just want to say thank you again for participating, and I'll see you on June the 8th. Thank you.